care is her passion. Pet care is her way of life. It's her inspiration.
Pendragon Clinic. We're here to discuss tube feeding for this session. What you'll need is, aside from your puppy, you will need a pentel pen, a 10cc syringe, which can actually be new or used, and the feeding tube. The feeding tube you'll be able to get in any local drugstore. This is a French 5 feeding tube, although you also have French 8 feeding tubes. Oh, sorry, this is a French 8 feeding tube, but you will also be able to find French 5 feeding tubes in the local drugstore. And of course, you have your formula. And we'll have to mark down up until which part of the tube we will be inserting into the pup. So first, we try to find out where the floating rib or the 13th rib is, which is around this area. You'll be able to palpate the floating rib. And it's about this location where you have the puppy or the kitten's stomach area. So what our goal is to put in the tube up until the area of the stomach. So you want the tube to reach this area. So we'll put the tip of the tube right where the floating rib is, and then we measure up until the tip of your puppy's nose. So it's about here. And then we're going to take our pen and we're going to mark it down to that area. Okay, next we're going to fill this tube up and the syringe with milk. Of course, we're going to take out the needle. Okay, puppy's hungry. Okay, we're going to put that in. Take your formula. And I'm going to aspirate some milk. Usually puppies this age, this is a day-old pup, which is about a medium-sized breed. They usually will be able to consume about 5 to 10 ml for the first week every 2 to 4 hours. So here, we open the mouth the same way we do an oral medication. There you go. And then you put the tube above the tongue. Note, it has to be above the tongue. The puppy will then go through a swallowing reflex. See, it swallows, and you push in the tube as it swallows. You'll feel some resistance, which means you're in the esophagus and not the trachea. So you push in the tube up until the mark that we've made right there. Right? You'll know you're in the stomach because if you're not, you won't be able to reach that mark. So you're going to press that down, make sure it doesn't get pushed out, and you're going to start putting in the milk. Right? So notice the puppy is settling down. It can actually feel the milk going into the stomach. Right? So there, and you pull it out. Now, the disadvantage to tube feeding as opposed to doing a regular bottle feeding is that the puppy may lose its suckling reflex when doing a tube feeding. However, when you have a large litter that needs feeding, the tube feeding is preferred because it's a lot faster than the bottle feeding. So in which case, we would recommend a tube feeding for weak pups who can't suckle and for large litters. However, if the puppy is strong enough, it would be advisable to have them bottle feed at least once or twice a day. So that ends our tube feeding lecture. So we'll see you next time on our how to stimulate your puppy to pee and poop.
May puso kung mag-alaga, may malasakit at kalinga. Cause we know how much you love your pets, that's why we treat them like our own. Wala na alaga ang alaga mo sa Pendragon Veterinary Clinic.